Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. Thank you for joining me. We're going to talk a little bit about the COVID-19 metrics and what those mean, the CDC guidelines for wearing masks, and the new vaccine announcement for SARS-CoV-2, the virus that causes COVID-19. So we're seeing record numbers of new cases daily. Death rates were stable, but now they're starting to rise as well. Many of us have not had a personal connection to COVID-19, but it's getting closer to home for most of us. This will increase our risk for exposure, so we all need to do our part to slow the spread of this disease. Now, what is this rise in cases doing to our system? Well, one of the main things it's doing is causing a shortage of beds, both hospital and ICU. The more people we have with cases, the more hospitalization that will be required. And at some point, we're not going to have the ability to take care of everybody. We're not going to have the equipment to take care of everybody. We're not going to have the healthcare providers, nurses, staff, reagents to do the test. We're going to run out of things. So it's imperative that we do all we can to slow the spread of this disease. The CDC issued new guidelines for wearing masks, and basically an understanding that mask not only allows us to protect other people from us, but the mask protects us from others as well. And the thought behind this is that masks decrease the amount of virus that we inhale. So if we don't inhale as much virus, it's correlated with not getting as sick. So that's the other important reason to wear a mask. The other important thing to remember is that a mask with a vent is not an effective mask, and it's not recommended. The new vaccine for SARS-CoV-2, which causes COVID-19, was announced this week. Now, there are several companies working on vaccines, and they are in the final stages of their trials. So we expect to hear more about vaccines as they are released in coming months. First of all, we need to remember that while this news may be encouraging to some, the information about the new vaccine is just that. It's news. It's a news release, and it has not been peer-reviewed. This vaccine and the protocol has not been reviewed or released for use by the FDA, nor has the FDA issued emergency use authorization at this time. This is exciting news for another reason. This vaccine is different because of the technology developments that have occurred in medicine. This is a different vaccine than what we've seen in the past. We expect that it may be safer, but that's yet to be seen. It will still be months before a vaccine is reviewed, approved, and available for the general public with a plan for distribution. Many of us are concerned about taking the vaccine. That's understandable, since there is a recent and past history that gives us cause for concern. But remember, this is not the flu. This is worse. We can't predict who will be asymptomatic, who will have mild disease, or who will be seriously ill or die. So that gives us a lot to think about over the next few months. We expect that when we are assured that this vaccine is safe and effective, that it will be ready for us to take. The best thing we can do now to protect ourselves and our loved ones is to practice the habits already mentioned that are shown to reduce the spread of this disease. Thank you so much for watching. As always, be safe, be healthy, and stay prayed up.